Test, test. Hear me now? Okay. Good afternoon. Thank you for joining us this afternoon. We have several updates for the community. Up first is Mayor Sarah Karen.
Thank you, Jennifer. An emergency ordinance was passed by the City Council yesterday. Generally, indoor recreation businesses serving groups, entertainment, and on-site food, beverage, and inhaling services are stopped. Daycares, salons, maid and massage services, retail stores, offices, and industrial businesses are not ordered to stop by this ordinance. Here's the wording in the ordinance. All restaurants, food courts, coffee houses, bars, breweries, distilleries, wineries, clubs, cafes, and other similar places of public accommodation offering food and beverages for on-site consumption, including any alcohol licenses with on-sale privileges, are closed to on-site, on-sale patrons. These businesses may continue to operate in order to provide takeout, delivery, curbside service, and/or drive-through service. All recreational facilities, public pools, health clubs, athletic facilities, and theaters, including movie theaters and music or entertainment venues, are directed to close and cease operations. All hookah lounges, cigar bars, vaping lounges, or other similar businesses which allow for on-site consumption are directed to cease allowing on-site consumption, but may continue to offer products for sale to consume off-site in the same conditions as bars and restaurants. City buildings are closed to the public, but the outdoor park facilities may still be used. Physical activity is important to a person's health and well-being, so we urge everyone to continue to get exercise and fresh air while using proper social distance from others. The snow has been removed from the trails to make them more accessible. The golf course will be opening soon with new social distancing and hygiene requirements. The dog park and gun range will be open back up with the expectation that people will utilize them in a manner that does not risk the health or well-being of themselves or others. Fortunately, when we started planning for this event a few weeks ago, we were able to use a previously prepared pandemic plan that had been done a number of years ago for an influenza outbreak. Much of the organizational work had already been done, and we only needed to update it and put new people in the roles. Our plan identifies an organizational structure called the Unified Command Team, identifying key individuals in dozens of roles, including both physical and mental health care, public safety, funeral service, business, schools, finances, logistics, managing volunteers and donations, working with other government agencies, and more. We have a plan for when the surge happens at our hospital. Our command team is meeting frequently, sometimes many times a day. We know we have to change the way we behave. There are creative ways people can protect themselves and others, and I call upon citizens to use every resource available to your fullest ability and capacity to limit interaction. Circumstances change quickly, so I urge everyone also to take personal care to help practice responsible living and prepare for the future. We will achieve our goal of slowing down community spread as much as we can in order to give the healthcare professionals the upper hand with the COVID-19 disease. As the governor said, this disease is not expected to peak until May. Meanwhile, we are doing everything we can to keep this community healthy and to be ready to get back up and running 100% as soon as possible. Thank you.
Good afternoon. The Cottington County Board of Commissioners met this morning for our weekly meeting. At the meeting, we did pass unanimously Cottington County Resolution number 2020-7. – This resolution mirrors the City of Watertown's resolution. So the mayor just read the insert of what is allowed and not allowed, and the county is following those guidelines as well. This will become effective at 12:01 a.m. on March 26, 2020. The entire resolution will appear on coddington.org and will be accessible for the public to review. Thank you for your cooperation, and please stay safe.
Good afternoon. I'm Casey DeBoer, President and CEO of Prairie Lakes Healthcare System. To further decrease the risk of COVID-19 in the region, Prairie Lakes Healthcare System is announcing that we will start screening staff, patients, and visitors entering our facilities starting Wednesday, March 25th. Screening will happen at the emergency room and surgery entrance on the east side of the hospital, the main hospital lobby, and Prairie Lakes Specialty Clinic entrance. Screening will also occur at the Prairie Lakes Cancer Center and Prairie Lakes Ear, Nose, and Throat Clinic at Mallard Point. All other entrances to our facilities will be locked. Screening is different from testing for the virus. Hospital staff screeners will take the temperature of those entering the facility and will ask a series of questions related to COVID-19 symptoms and exposure. The quick screening will help protect our community, our patients, and our staff. Wash your hands, stay home, be well. Thank you.
Thank you, Mayor Sarah Karen, Brenda Hanton, and Casey DeBoer. Are there any questions?
If we could get Casey
Yep.
back up, please. Mr. DeBoer, the decision to start screening your staff, employees, was that your call? Did staff come to you and say, maybe we should do this? How did that situation come to this conclusion to do it?
The question is, how did we come to the conclusion to start screening staff, patients, and visitors? I think it's based on what we're seeing happening in the industry in some of the areas that are harder affected by this, as well as discussions with our staff and our leadership team about what we need to do to protect our staff and patients as we go forward.
Supply-wise, are you adequate for what you need, and are you confident that if there's a surge, you will have everything you need at your disposal?
The question is about our supply chain and whether we believe we have adequate supplies going forward. Right now, we feel we're in a pretty good position. We are advocating with our staff that they be very vigilant in their use of personal protective equipment, or PPE. And we're monitoring the CDC for changes in those guidelines as we go along, which are aimed at extending our ability to use those. We think we're in a good situation to begin a surge. We order supplies on a daily basis. We've been cooperating with the state related to where we have needs and their cache of PPE. And so we're confident that we'll get through this.
If you have a patient that has tested positive and is hospitalized at Prairie Lakes, what changes?
The question is, if there's a patient that tests positive for COVID-19 and is hospitalized, what changes in our operation? To be clear, we've had no patients test positive and be hospitalized at Prairie Lakes at this point. For us, the procedures that we follow, the infection control procedures that we follow for these types of infectious diseases don't change dramatically. But clearly our staff and our providers and everyone is very heightened to the awareness of this disease and are very prepared. They've been well educated, they're using their PPE appropriately, and they're very well prepared to take care of these patients if they are hospitalized.
I know you've been in the hospital administrative business excuse me, for a long time. I would assume this is your first dealings with a pandemic like this. Is that safe to say? The
reporter asked how that I'm old. Yes, the question was, I've been at this a while, and is this my first pandemic? I've been in this career for over 30 years, and clearly this is the first time any of us have seen something to this extent. We worked on something similar but different in about 2008, 2009 related to H1N1. The scope of this epidemic and what we're being required to do is dramatically different, but the preparedness of your healthcare system here and from a public health standpoint and across this state remains the same. We're ready to deal with this.
How do you train for it? How do you put together a playbook to deal with a worst case type of scenario?
The question was, how do you prepare for something like this with a worst case scenario? Well, since you pointed out how long I've been doing this, I think in the last 20 years, I believe I've participated in at least 3 tabletop exercises at a statewide level, preparing for something very similar to this. So the language and the things we're talking about having to do aren't new ideas. They're just new to be implemented. Most of us have never implemented some of the things that we've implemented in the last couple of weeks, but we've been preparing for it for a long time. As an industry, the Ebola a couple of years ago and the Zika virus that didn't really get to this area, but we were able to observe what was happening in other parts of the country and what they were doing. We've learned a lot from that. Nationally, we have a pretty cohesive system of trying to deal with these types of events. This is an overwhelming event, and what we're trying to do is flatten that curve so that we don't, as a local health system or a statewide health system, get overwhelmed, and we can care for these patients over time instead of all at once.
To what extent do you have conversations with fellow healthcare administrators, clinics, people outside of Prairie Lakes, because obviously you're all dealing with this together, and at some point there may need to be cooperation involved?
The question was related to cooperation with other entities. That is become a major part of all of our day, is communicating and collaborating with each other. We are in fairly constant communication with Brown Clinic and the Sanford Clinic here in town, as well as the Quick Care Clinic. We are all on the unified command structure that is meeting at least a couple times a week to talk about what we need to do for the entire community process of being prepared. In our communications with the other local healthcare entities, we're talking about how we can do things in a similar way so we don't create confusion in the public, and making sure that we're helping each other where we can. We've done some things to help each other get prepared for this. And then it goes beyond that. Obviously, we're working very closely with the State Department of Health, who is one of our key resources, and the governor's office, obviously. And the other regional health systems in Sioux Falls have been gracious enough to share information with us. We're sharing information with them. We are planning for this on a statewide response basis.
One last question. For somebody who is dealing with a health or a medical condition, and it doesn't relate at all to the symptoms of coronavirus, and they're maybe a little hesitant to come in because they feel like they might be burdening you or taking away from the focus of what you're dealing with right now, what would your message to them be?
My message would be to be in communication with your physician. I think I can say all the clinics in the community are utilizing some telehealth options that have opened up through waivers from the federal government to allow visits to your providers to happen in your home setting, so you don't have to come in to the clinic or to the hospital to have that happen. And so be in communication with your physician. If that's appropriate, they'll suggest that. If not, they'll determine if they need to see you. I think a lot of the providers in the clinics are postponing some of those more routine things till down the road when maybe we're beyond this, depending on how long that is. You know, we instituted last Friday that we're postponing all non-essential elective procedures for the safety of the public, but also to preserve that PPE we talked about earlier. And so that went into effect Monday morning, and our surgical volumes are down. And that's what we expected to see, and that's what we need to see. Some of the surgical procedures we do can wait. But I think the other key message is for those emergent and urgent procedures, we're still here for people. And your physicians are still in their clinics and willing to treat you for those things that have to be done right now. So be in communication with your provider.
Thank you.
Yep, thank
Can
you.
we get Mayor Karen? Slide in.
We do have one more update from Lisa Johnson.
Thank you. My name is Lisa Johnson. I'm with the Department of Labor and Regulation. Just want to give an overview of unemployment insurance because that is obviously very, very hot now with, unfortunately, businesses closing because of the need to close due to the COVID. Workers who've become unemployed because their employer needs to temporarily shut down or isolate workers due to the COVID-19 might be eligible to receive benefits. Many variables can affect a worker's eligibility and an employer's liability for benefits. To file a claim, visit raclaims.sd.gov. I'm going to give you the number, but we hesitate to have you call because the call wait times are over an hour. 605-626-3179, but please use the website raclaims.sd.gov. You will need your social security number, your driver's license number or state ID number, and 18 months of work history. If you get an issue at the end of your claim, a claimant gets an error message. The message will tell the claimant to call, do not call. Instead, they should email DLR RA Division at state.sd.us. Our office is closed, but we are taking phone calls to the public. Our local number is 882-5131. We are staffed in there, just 2 people at a time. We are taking phone calls. So the current wait time for the Unemployment Insurance Division is about an hour. They have added 16 more staff in this area to help take calls, reset passwords, and process online claims. 92 phone lines were available, and they added an additional 23. Thank you.
Mayor, I'm just curious, since the vote was taken yesterday to close down the non-essential businesses, what kind of reaction have you gotten from business owners? I would imagine it's a mix of some that aren't very happy, some that are understanding, and maybe some that agree with the decision. Can you kind of characterize what you've been hearing since then?
Sure. The question is, what has the reaction been to the council's action to close some of the businesses? And I want to first clarify, there wasn't a blanket closure of non-essential businesses, and that's really confusing a lot of people. There were specific types of non-essential businesses which draw people together in groups that were closed. And the reaction has been mixed. As you said, there are a lot of people that said, about time, why didn't we do it sooner? And other people that think that we're going to wreck the economy. And we do know that this will be very difficult for the economy. And it's just a matter of weighing it out, lives against potential financial loss. We can recover money. We can't recover lives lost. So that's why the council was unanimous in their decision. I'm sure that's why the county followed suit, and other cities and counties are doing this across the country. It's because we know we can have some control on the peak of this disease. We can trim it down by shutting things down, and there's a financial impact to that, but we save lives in doing that. So that's why we've done it.
And it's open-ended, correct? There's no expiration date at this point on when they can reopen?
Right, and the council passed that, and we'll be actually revisiting it at a future council meeting in 2 weeks, and we'll discuss it again at that time. But the council can reverse its action at any time. So we don't intend for this to go on 1 minute longer than it needs to. It is a drastic measure. We may need to make even more drastic measures in the future, but for now, we think this is the right thing to do, and so that's why we've done it, and we do believe that we're protecting the safety and health of our community.
As for the non-essential businesses that are being impacted by this closure, the places where people congregate, when you and the council revisit when to reopen them, whenever that may be, what kind of data, what kind of information will you be looking at to say, okay, now I think we can unlock the doors to those places?
Right. The question is essentially, how will we know when we can open back up? And what I would want to see, and we haven't discussed this, so I have to say that right out loud, but what I would expect to see is that the disease is on the downhill slide. The numbers are going down, they're not increasing, and that our healthcare community is completely in control, and that we don't want to create a second surge that takes it out of control. We want this to be manageable, and that's the whole goal. We don't think we can eradicate the disease with these measures, but we do think that we can maintain them at manageable levels.
Very general question, but what do you think the economic impact, and it's probably an unfair question because you don't know yet, but have you thought about what the economic impact to the city is going to be? And I know lives are more important than money, but obviously as mayor, you're kind of the bookkeeper over the city finances and the budget.
Right. I do think it will be grim. I haven't put a number on it, but I'm prepared to cut all projects if I have to. We do spend a great deal of our money on doing projects for the city. So the last projects that I would cut obviously would be our street maintenance projects. We don't want our streets to fall apart. We have an annual street maintenance project that we do. But the other projects for recreation facilities and those sorts of things, we'll just have to put those on hold until we see how we come out. And maybe it won't be bad. We have to hope for the best, but we are planning for the worst.
The number of cases have gone up only by 2 since yesterday. The latest data I have is it went from 28 to 30. And we in the media, we're talking about this constantly. It's all we're talking about. When the numbers statewide only go up by 2 in a 24-hour period, do you worry about people getting complacent that we in the media are overhyping it because we're just reporting what we're being told by the experts?
Right. The question, that was a long question. The question was, we only went up by 2 in our state. We went up from 28 cases to 30. And if that's the case here, are we overreacting? And I would say absolutely, we are not overreacting. I'm very proud of the plan that we have and that we're able to quickly implement a plan, that we laid that groundwork before we had a problem. And so when the problem comes, we are managing it, and we're managing it quite well. Other states weren't that lucky. I mean, we have the benefit of being in the middle of the country and being in a rural area, and we can watch this happening on both coasts and throughout the world before it comes here. So others were taken by surprise, and they had a surge very quickly. And we haven't seen that yet, and maybe we won't. Maybe we've knocked it down when it was small enough that we won't ever have a big surge, and we won't need to implement any of the next measures that we have in our plan. We're not going to implement things that we don't think are necessary. We're just going to be careful and be observant and watch how things are going.
How hard is this on you personally as the mayor to basically be the person in charge of the city during something that this city and nobody has ever experienced before? What's this like personally for you?
I feel for the businesses. He asked how this is affecting me personally. I feel for the businesses. Right now, we don't have deaths in our community. So all I know is that businesses are closing. That's the only impact we've seen so far. And people are inconvenienced. I feel bad for the inconvenience, and I'm terribly sorry for the economic impact to families. But I'm just bracing for the illnesses and the health impacts that this could potentially have on our community. And so I'm reserved in that respect. I don't think that this is anything that I shouldn't expect to do as the mayor. We have a plan. I'm implementing the plan along with the other unified commanders. I'm not alone in this, and I speak for the community when I speak, and luckily Watertown is such a strong town. We have great support. We're all unified in this together, and we're acting together as a team, and fortunately it hasn't been a big deal yet, and I hope it doesn't become one.
Can I get Brenda up for one question too that I thought of? Brenda, I know that there are county elections coming up. I think the primary is in early June, and there are candidates that are going to be running for office. and a June primary that's like 8 or 9 weeks out now, and we're told that the cases might not peak until May. Has there been any discussion at the county level about the impact this could have on the election, if it could be postponed, moved? Are you even allowed to do that?
We've had those discussions. We have those same concerns. And as of now, you know, we will need direction from Secretary of State on what we're going to be allowed to do. So, you know, we have not heard yet how that is going to take place.
Thank you.
All right. Again, thank you for everyone who presented today, an update, and